My name is Dr. Loretta, and today I'll be talking to you guys about the signs and symptoms of trauma. So, one of the signs and symptoms of trauma is guilt and shame. This is one of the biggest things. You hardly see anybody who's been through any kind of traumatic experience that doesn't experience some form of guilt and shame. It comes in the form of self-blame, feeling as though they could have done something to have changed the situation or prevented the situation. A lot of times people feel that they could have controlled something, they could have done something, they were at the wrong place. If they weren't in that place, that wouldn't have happened. For people who've experienced any kind of like sexual trauma, will feel as though that maybe they were dressed inappropriately, or the likes of people who abuse happened under the influence of alcohol or any kind of substance will say things like, if I wasn't intoxicated, this wouldn't have happened, and yada yada yada. Of course, we know there's no evidence to actually back the fact that this wouldn't have happened if they had done what they think that they could have done. And even if that was the case, at this point in time, you can't turn back the hands of time, right? Number two is nightmares and flashbacks. For people who's experienced any kind of traumatic experience, one of the things that tend to happen with them is that this experience gets to be embedded in their subconscious, and that's why they go to bed and there's like a replay of the traumatic experience. Sometimes the nightmares might not be exactly what had happened to them. The nightmare can also be in relation to what has happened to them. So I'll give you an example. Someone who was sexually assaulted, they necessarily might not always dream about exactly what happened during the assault, but however, they could be dreaming about assault happening to them, but not necessarily exactly what happened and who did it to them. You see a lot of repeated disturbed dream of the traumatic event, feeling of fear, acting as if they were in that stressful situation, the incidents of waking up at night while asleep, waking up in panic from dreams with sweatiness. They do get flashbacks, not necessarily when they are falling asleep. They could be having conversation with someone and the memories of the events will come flooding, and of course there's always a lot of emotional reaction that comes with that memory. You see a lot of sleep problems. For people who've experienced trauma, you see a lot of either difficulty falling asleep or difficulty staying asleep, or both, difficulty falling and staying asleep. They tend to have a lot of sleep disturbances. And of course, because of having repeated nightmares, sometimes those nightmares disturb their dreams to where it wakes them up from sleep, and sometimes they have a hard time going back to sleep because there's also that fear component to the dream. Number three, avoidance. The key term for anybody who's experienced trauma is always avoidance. This is classical for any traumatic event. People tend to always want to avoid the memories, avoid anything that reminds them of that trauma. People, places, conversations, anything that just brings up that memory for them. By default, people feel more comfortable like just stashing things in a box, putting it away, and just moving on with their life. So there's that huge avoidance component. There's also dissociation. Some people use dissociation as a coping mechanism. You tend to see dissociation a lot more with people who's experienced childhood trauma, because that became their coping mechanism and their escape from reality, so that they don't have to face reality of what they've experienced or what they've gone through. Number four, isolation. So of course, someone who's experienced a traumatic event would have like negative beliefs about themselves, negative beliefs about others, negative belief about the world. So for someone who has negative beliefs about the world, so let's think about like 9/11, right? People who experienced something like 9/11, of course, not all of them for sure, but some of them will experience that negative belief about the world, like the world is not a safe place. And someone who thinks that the world is not a safe space or a safe place, what do you think that they're likely going to do? Untrusting? Absolutely. There's always trust issues with people who's experienced trauma. Paranoid, isolate, you want to keep themselves safe, or at this point they feel like that thing that happened to me, I didn't have any control over it, and right now I need to take control over what I can control so that I don't find myself in that type of situation anymore. So one of the ways they tend to take that control is actually by isolating. You see them cutting off friends, social interaction, events that they used to like, cutting off things that will put them in harm's way. Of course, you see a lot of blaming of others. Well, with people that have experienced trauma, one of the key terms you hear a lot is if this, then that. If the plane had not crashed, then 9/11 would have not happened. If the government had found out about 9/11 on time, then it wouldn't have happened. A lot of that, and that's what we call stuck points. They get stuck in that kind of mindset, and of course it affects their behaviors. That's where you see isolation. You see anhedonia, which is lack of interest in activities that they used to like to do before. Now they've given up those activities, or they don't have any interest in doing those kind of activities. Being distant and cut off, they don't feel like they fit in. Right? 5, depression and anxiety. For people who's experienced trauma, even if they get diagnosed with any type of trauma-related disorder, you tend to see following diagnosis, which is very common, of mostly anxiety or depression. You see problems experiencing positive emotions, irritability, feelings of hopelessness and helplessness, because they feel stuck. So there's that hopelessness, like there's no way out for me. How can I get out of this thing? What is my way out? Sometimes you see people that have been through therapy and they feel like it's not working. Then you find them in that sense of feelings of hopelessness or helplessness. 6, repression of memories. Like I said, it's classical for people that have experienced trauma, humans generally, to just want to shove their emotions to the side and just move on with their life. However, shoving your emotions to the side does not help. And if you guys have seen that meme from, I think, Family Guy, where the little boy was calling his mom and it's like, Mom, Mama, Mama,
Mom,
Mommy.
Mommy.
He was getting very annoying because he's calling his mom and his mom is not answering, and he's
Mama.
changing the pitch to the tone of
Mama.
his voice and how he's calling
Mama.
his mom just
Ma.
to get her attention. Every of our emotions are very valid, and our emotions are sending a message to us. So guess what? If your emotions is telling you something about that trauma and you're trying to repress that memory, it doesn't help you. It only just exacerbates your symptoms. You see a lot of intrusive thoughts, like they can't control the kind of thoughts that come to their mind. Repeated disturbed memories of the traumatic events, almost like the intrusive thoughts where they can't control what kind of thoughts come through their mind. It just comes and goes. Avoiding memories and feelings of the event, trouble remembering parts of the stressful event, or even remembering the stressful event at all. This is a big one, because sometimes you meet patients and you ask them about any kind of traumatic experience and they're like, nope. And down the road, they're like dropping some things and you're like, wait, you said you've never experienced trauma. Come to find out that they experienced a kind of traumatic experience at some point in their life. They just do not remember the incident. Again, that is also a coping way where they just try to shove that memory away and just move on, and they don't even remember what happened or bits and pieces of what happened. 7, emotional numbing. So this is huge because you see this a lot. People that experience any kind of traumatic event are more prone to substance abuse disorder, because they're trying to numb that pain, they're trying to numb that emotion. That's where you now start to see co-occurring disorders, where they're having both mental health disorder in conjunction with substance use disorder. They start to drink a lot of alcohol to drown their pain. And of course, alcohol cannot drown your pain. So you start with 1 bottle to drown the pain. Now you've moved to 2, now you move to 3, because you're not getting the same desired effect that you would get with the 1, and on and on and on. And you see a lot of erratic behaviors. You see a lot of sexuality. Number 8, you see hyper-arousal and hypervigilance. They're always on the edge. They're always easily startled. They're always on guard. Again, that's their defense mechanisms. This process happens in our brain and how we activate that fight, flight, freeze mode, right? That's where you see a lot of this, why you see a lot of this hyper-arousal or hyper-vigilance, feeling on the edge, looking over their shoulder as if something awful is about to happen again to them. Even if they're in a safe space, they feel unsafe even in a safe space, which is what makes it a problem. 9, physical pain. You see a lot of physical pain where sometimes it can be somatization, sometimes it's actual physical pain. You see people with trauma-related disorder more with like comorbidities like fibromyalgia. You see a lot of headaches, migraines, dizziness, stomach ache, digestive problems. So it could start from a mental disorder, but now you're having some physical responses to the mental health symptoms, right? Because all your functioning, both your physical functioning and all, is all wired through your brain. 10, mood swings. You see a lot of anger outbursts with them. You see a lot of feeling upset about memories of the trauma whenever they remember whatever, anything that triggers that traumatic event for them or memories of that trauma event. It exhumes that anger emotion or irritability or aggressiveness. You see strong negative beliefs about self, negative emotions such as fear, anger, and of course someone who has strong negative belief about themselves what kind of emotions do you think you see? See a lot of self-sabotaging behaviors, you see lack of confidence in themselves. 11, behavior change. See strong physical reaction, like someone has memories of the traumatic event. I see them acting like they're fighting, but they're not fighting with anybody. This is not very common, but last but not the least, psychosis. You see people who's experienced some traumatic events end up breaking out into some kind of psychotic symptoms, be it actual delusions, paranoia, auditory, visual hallucinations. And some of this can point down to some of the signs and symptoms I talked about earlier on, like from someone who is already having sleep problems, where now they're to the point of insomnia and they're not sleeping at all. You can understand why someone can end up breaking into psychosis. Right? They don't necessarily need to even have any family history of any kind of psychotic disorder, but they end up having this psychosis because they are not sleeping well. Their brain is all, forgive my language, jacked up. Their body system is all messed up. It can end up messing them up to the point where they're having some psychosis. I hope this was helpful.